I would like to present two of our most recent articles that are part of a much larger research program that outlines a new psychotherapy called Externalizing Metaphors Therapy, or EMT for short. EMT research began back in 2012, focusing on addressing anxiety with children on the autism spectrum. The research since then has shifted to include the neurotypical clinical populations of youth presenting with anxiety and depression. 10 separate research teams have developed the model and evaluated it through randomized controlled trials in Ontario, Canada, and a small clinical trial in northern Portugal. In a nutshell, EMT is a short-term treatment intervention primarily based upon the externalizing of problems, the transforming of metaphoric imagery, and the shifting of underlying maladaptive emotional schemas. It's strength-based and client-centered. Counselors, social workers, registered psychotherapists can use the EMT model in their private practices, hospital settings, non-for-profit government agencies, and the like. The current video abstract will address our 9th and 10th published articles. The first article represents our 8-session model, and the second article represents our walk-in clinic model. Both models are for children and youth on the autism spectrum presenting with emotional self-regulation challenges. The uniqueness of the 8-session treatment intervention is that it relies upon client-centered preferred interests as catalysts for therapeutic change. So rather than view preferred interests as treatment interfering behaviors, EMT tries to encourage their purposeful and playful use in psychotherapy. Preferred interests are elicited by the therapist and externalized through the creation of a personalized metaphor. The metaphor problem is then shifted through client strengths and strategies, impacting the relationship between the client and problem. This process changes the client's underlying maladaptive schemas. The walk-in clinic model, on the other hand, is quite different because the therapist has only 60 to 90 minutes to engage the client. This may be through the client attending a mental health walk-in clinic or the fact that the client is only attending up to one therapy session. The walk-in clinic article describes the EMT model through a structured and integrated approach to treatment. A self-regulation map metaphor is visually and interactively used to link client challenges, strategies, and motivations as they all relate to the problem. The map metaphor is collaboratively created with interactive technology on multiple electronic devices. The map metaphor helps the client and family better manage self-regulation within the home setting first, and then possibly the school and community settings later. You will find a treatment protocol explained within both of our articles and expressed in bulleted format. Each article presents a case study with illustrations, scaffolding the theoretical constructs of the model. We hope you will find these articles and our other published articles informative, challenging, and useful in your own clinical practice as you reflect upon your own work within these fields. On behalf of our research teams, we thank you.